Hello, good evening. My name is Luis Ochoa, and tonight I would like to talk to you about the SWAPA Trial Analysis, a quality improvement initiative. First of all, I would like to define quality improvement in the healthcare field, and I'm going to define or quote the U.S. Department of Health and Human Services as following, quote unquote. It states quality assurance consists of systematic and continuous actions that lead to measurable improvement in the healthcare services and the healthcare status of target patient groups, which means obtaining data based on certain actions to measure improvement on patient outcomes. The Mupirocin and Idofort SWAPA trial is a randomized trial of 140 hospitals with the assistance of the CDC in order to help the reduction of hospital-acquired infections by comparing two different initiatives. Why is this needed? The Reduced MRSA trial was published in 2013, and it demonstrated the benefits of using mupirocin and chlorhexidine wipes in the ICU. The combination of these two reduced the number of MRSA infections in the ICU floors. Now, there is concerns if the use of mupirocin, which is an antibiotic, will lead to resisting bacteria. So, what is the goal for this quality improvement initiative? The goal is to find out if using Idofort, a nasal antiseptic, can be just as effective as using mupirocin in preventing hospital-acquired infections when used with chlorhexidine showers. If so, are the patients getting the best possible action in infection prevention without facing the risk of being exposed to a new resisting bacteria? Hospital-acquired infections are a top priority on all hospital settings across all the United States. The organizations such as the CDC and the Joint Commission keep track of national rates for CODIs, CLABSI, C. diff infection, MRSA infection, and surgical site infections. This is a national standard that needs to be addressed. The hospital documents findings involving admissions to the ICU, patients treated with mupirocin, and patients treated with Idofort, as well as the number of positive MRSA cultures and bloodstream infections for those patients who had been admitted to the ICU. The quality indicators allow keeping track of the efficiency of the use of Idofort when compared to mupirocin. Collecting the data starts at the ICU floor level and finishes with statistical analysis, from all the universities included in the study, as well as the infection controls for the CDC. Some of the universities involved are the University of California, Harvard Medical School, University of Massachusetts Amherst, Rush University, Stronger Hospital of Cook County, and the hospitals, of course, including all those 140 hospitals that are involved in the initiative. Quality Improvement Initiative is funded by the CDC with federal funding, and all reports and findings are given to them. Once the study is concluded, it will be published and available to the public as well. Nurses are the center of this trial. It is impossible to complete the quality assurance trial without the support from the nurses. Why are they so important for this trial? Because the nurses are the ones that apply the antibiotic, the mupirocin, the chlorhexidine bath, and this must be done properly and consistently in order to acquire proper findings. The initiative requires not only nurses but a more complete multidisciplinary team. Physicians and pharmacists must work together to assure that all patients admitted to the ICU are scheduled to receive their doses of mupirocin. Lab staff must provide correct actions when managing blood samples, specimens, and other cultured items for them that receive in their laboratory. Even suppliers assist in the measure by complying with the large demand for chlorhexidine wipes. In-services were available to nursing staff before the start of the trial. In-services were short and covered only the basic information regarding the trial. This due to the fast pace of the unit. Nurses would be educated on the subject when taking care of ill patients. Any prudent nurse, I believe, will prioritize the well-being of their patients over information on this trial. Also, bathing in our unit is usually performed during the night shifts, and many times the unit staffing numbers are low, which places more responsibilities on the nurses and could affect proper bathing for patients, as well as the compliance of nursing is very important. All of these are challenges in the workplace for an effective analysis of the initiative. In order to solve the challenges, the hospital can make the effort to train nurses on the matter when nurses are off the floor and they don't have responsibilities with their patients. With more nurses on the floor, it is more likely that all the patients could be bathed as they should properly every day. And in reality, in our unit, I can express that there is no real tracking of patients being bathed properly or being bathed consistently day by day. I feel management should be on top of this situation and assure that patients are bathed every night. In order to solve some of the issues again, if possible, we would be able to hire more nurses or CNAs, which we don't use CNAs in our floor, and they could assist us in facilitating some of the responsibilities and with proper bathing. Charge nurses should also be diligent on having floor nurses bathing their patients every day, and of course training the staff with proper knowledge and proper evaluation should be performed for the trial. The swap-up trial is specific only to ICU units and all of the 140 hospitals that are involved. After the results from the initiative are concluded, findings can be shared and utilized on other hospital floors. And by sharing these findings in our unit, we can hopefully reduce hospital-acquired infections not only in ICUs, but also in medical and surgical floors, which would be great for all of the hospitals and our patients as well. This quality improvement initiative will benefit patients by lowering the hospital stay by preventing hospital-acquired infections. It would also benefit the hospital by obtaining full payments from insurance companies and will improve the hospital's outcomes. Findings from the study will change the practice on the ICU floors, as it is a very important initiative that's being started here, and it will lay the foundation for future prevention of hospital-acquired infections. This project is based on the participation of nurses, and even though the findings will be available in a couple of years, it will help change the healthcare field. Thank you for listening, and I hope you have a good day.